Getting older involves change, both negative and positive. But you can enjoy aging if you understand what's going on with your body and take steps to maintain your health. Many different things happen to your body as you age. Don't let those changes catch you by surprise. Today, we will share the simple ways to promote healthy aging. We will also discuss important ways of looking at medications you take. Are they making you feel better? Do you have a current list of medications? What to do with medicine you don't take anymore? Practicing healthy habits through your life is ideal, but it's never too late to reap the benefit of taking good care of yourself. Today, it's my pleasure to welcome to the show a true expert in the field of geriatric medicine, Dr. Gokula.
Caring for older people with multiple health problems can be tricky, even for healthcare professionals who specialize in geriatrics, the medical care of older adults. Older adults have special healthcare needs that can make their medical care more complicated. More than half of adults age 65 and older have 3 or more medical problems, such as heart disease, diabetes, arthritis, Alzheimer's disease, or high blood pressure. For example, prescribing medications for a patient with multiple health problems is more complex. A drug that might be useful in treating one health problem can make another problem worse, and taking multiple medications can cause problematic drug interactions and side effects.
It's my pleasure today to welcome Dr. Gokula, who is the Program Director of Geriatric Fellowship at the University of Toledo. And as an expert on aging and the most common problems we see it in our senior people and that geriatric generation, which is really, we care so much about them. I'm sure all of us, we have the moms and dads which we like to take care of, and it's my pleasure to welcome you on board.
Thank you, sir. It's nice to be here.
Thank you. In geriatric generation, in all of those senior people, I'm going to start with the most common issue we deal with, which is related to medications. I have a feeling that we are over-medicated this group of population. What do you think?
Absolutely, you're right on the target. And one of my campaigns is to de-prescribe. This year at the American Geriatric Society, we're going to do a symposium about de-prescribing.
Okay.
I have had maximum number of patients follow me because I stopped medications. When I came to town 8 years ago, I was the hospice medical director.
Sure.
And when I stopped medications, patients felt better. The problem is, rather than focusing on function quality of life in older adults, we are focusing on the disease.
Okay.
As you age, you have more diseases. So you have more guidelines.
Sure.
And more pills. So if you put adverse drug events, which is the side effects of medications, as a disease, it's the 5th leading cause of death in the United States.
Wow.
So medications have a lot of problems, and older adults should pay attention to how many medications they're taking. And the medication should really make them feel well. If they're not feeling well by taking a medication, then I think they should question, should I really use the medication?
So that brings me actually to the patient ability to distinguish about some of these side effects from the medication, because really the patient is coming to the doctors to help them, to give them the right medicine. So I mean, it's very hard for the patients when one of us, for example, telling the patients you have to take this supplement, this medicine. I mean, unfortunately, most of the patients, they don't recognize that they are taking too much or unnecessarily some medication.
I totally agree with you. I think it's a partnership between physicians and the patient.
So based on that, I mean, how can we deliver that message in more effective way to this generation of our senior? I mean, try to tell them, watch it, this is right, this is not right. I mean, because it looks like there's some disconnect between patients and physicians. We are participating somewhat in or contributing to this problem.
So for the patients, as far as my education goes, I always tell them, when you're taking more than 9 medications, always question
9
or above. because that's really
You know
severe
that about
polypharmacy.
70% of the senior people, they
Right.
take about 10 to
Right.
12 medications.
Right, I agree with you. And then I'll ask them, are you feeling better taking all these medications? What are all the problems you have? So when they complain, I really look at medications the first problem. I put medications as, could this symptoms be caused by the medication?
Sure.
And then if they're not feeling well, then I'll start from there. So I'll ask them to come back to see me if they have any problem. They need to bring their list of medications each time. When they go to the hospital, some are stopped, some are started. So they really need to bring all the pills that they have. And I have done home visits, and they have the closet, and they have like 30 pill bottles there. And then they have 20 on the list. 10 of them are expired. So it's important that they discard the medications. Now University of Toledo and other hospitals are actually giving you the facility to bring your pills and give it to them so they can dispose them off, rather than throwing them underneath. So that's the way. 9 or more, they should talk to their physician if they're not feeling or having any symptoms.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
For years, it has been common knowledge that people who are under a lot of stress have an increased risk of heart disease. But what can be done about it? Simple. Have more fun. Dance, golf, sing, garden, make love. Do something to help someone else. Your heart will thank you. Come on, you can do it, because time waits for no one.
Joyce Graham is in her 5th month of this class. She says it's been a big help for her mobility. She was sent here to this class because she fell a lot.
I was on the floor and it was bloody, and I had folks having to come and pick me up 5 times before I came here.
It's people like Joyce who were targeted in a study by the Centers for Disease Control.
After the age of 65, there is a 50% reduction in a lot of organs of the body. And one of the main organs that is affected is the muscles, more in the legs and more in women than men.
How are you doing this morning?
Dr. Zahir Khan is a geriatric specialist. He says muscle loss can lead to falls.
And as a result, they take short shuffling steps and stoop forward. Research has shown that if you exercise for half an hour, 5 days a week, you can improve your muscle strength, flexibility by 50 to 70%.
Left shoulder.
It's part of a local program targeting the elderly.
Directly over, underneath your knees. Your knees are over your heels, sitting up straight. We're going to 7, 8, 9, 10.
So one of the exercise programs that we do in about 11 churches in Huntsville area is for them to stand up by pushing only one hand and keeping the other hand folded. And after a few weeks, we tell them to fold their hands, do not lean forward, and stand up.
He says this simple exercise can reduce falls by 7%. He says all people need to have a neuromuscular examination every 6 months to determine mobility. For patients like Joyce, it makes a big difference.
I haven't fallen in a long, long time. So
It's been a good thing then.
it's been a good thing.
With your health, Bobby Shuttleworth, WAFF 48 News, Huntsville.
Now, let's shift toward the diseases which is really affect our seniors. And if we start talking about the priority, or I mean, which one is the most common, in your opinion, disease they face at this point?
So I would start from prevention, because I believe in preventing, which is the most.
Sure.
So aging for different organs happens a little differently, but predominantly there are 2 things that I would really focus on preventing. One is their muscles. So I would like them to kind of keep their muscle tone intact by doing aerobic exercises.
Sure.
And I want their muscle bulk to grow by doing weightlifting as much as they can tolerate.
Sure.
And based on the medical problems they can. If they can do both aerobic and we call them isotonic exercises and isometric exercises, or they can adapt. If they have arthritis, they can do water aerobics. So exercise has shown to help and promote healthy aging. High vegetarian diet with colored foods and Mediterranean diet has shown to help with longevity to some extent. I want all the older adults to have social relationships, and keeping life simple has shown to help longevity.
So if we are talking about, prevention, you know that all of what you suggested right now, it's not only good for the seniors, but also good for everyone. We always promoting aerobic exercise and some weightlifting and to eat healthy, and definitely for the elderly, it's more important probably than the younger one. So if we go back now, since you are talking about aerobic exercise, I know that one of the most common problems they're facing is arthritis, and that prevents them from moving around as much as they wish, or they exercise as much as they wish. So what is the best way to deal with arthritis in the geriatric population?
So in older adults, what happens is as you age, there is a physiologic reserve, and that's what determines how you are able to bounce back.
Sure.
We call that resilience of aging now. That's the new term. So when they have, for example, knee arthritis, so you go and take the history. So they have been running all their life on a cement pavement, for example. Now they can instead do an elliptical, which does not impact so much. So you adapt. So you adapt and modify the exercise, but don't stop moving.
Sure.
So there is an old saying called, if you don't use it, you lose it. And same way with arthritis, I would rather have patients modify and adapt their activity and continue doing and being active. And we'll come to this supplements, the glucosamine.
Yep.
Canadians have done a lot of studies on glucosamine, and it does not help moderate to severe arthritis.
It does not.
It's as though you're throwing your money. So
that's an important fact. You know that about 90% of the people with arthritis, they use that.
Yeah, exactly. It is only helpful for mild arthritis if it's in the early phases.
Okay.
So I would suggest that walking would be good if they have a lot of arthritis,
Sure.
because it does still help the bone density and it helps to keep them moving. And they can take Tylenol if they have problems with pain, in just a gram of Tylenol or 500 milligrams before they do any activity.
The basic treatment.
The basic
for arthritis.
treatment.
The second most common disease, I see it in elderly people when they come, and I remember the way we learned it in medical school, when elderly patient coming into the emergency room with some kind of very atypical symptoms, including confusion and not able to eat or drink or something like that, always look at two things. First of all is the infection, and the second one if they have a silent heart problem. Is that still the case?
Altered mental status is one thing that's very common that presents in the elderly. I would keep it very simple, the differential diagnosis, wherein I would start from hydration. Are they dehydrated?
Sure.
A lot of times they have not had, if they have dementia or if they're in the nursing home, hydration, if that doesn't happen, then it translates. The second important thing is constipation. They're often overlooked, and they get a CAT scan and a lot of blood tests. So I always tell the residents and fellows, please check their abdomen, and then if you have to do a rectal, please do that. They may not be able to give the history because they don't necessarily have exposed these people for radiation. And UTI, urinary tract infection. So urinary infection, pneumonia, you may not have classic symptoms like crackles in older adults, and all they present is with is abnormal. So I don't want people to jump to a conclusion and do CT scan on every older adult who presents to them. I would rather have them check for their hydration status, give them IV fluids, see how they respond in the next 1-2 hours, check their bowels and bladder, and then check for pneumonia.
So if we shift the gear right now toward another thing I hear also, and I see it actually in the elderly people, I've seen it in my dad, and is really anxiety and depression. Is this a very common issue in the elderly? Social problems?
Yeah, it's a common issue in the elderly, and it's often missed. And any new patient I see, I call the 3 Ds: depression, delirium, dementia. You screen them for all the 3 conditions. It's amazing to see how many people actually come positive. I would love them to do the confusion assessment method. It was developed by an internist. And PHQ-9 for depression. And PHQ-9 is somebody, even the family can Google, print it out and fill it. There is evidence that whoever does it, it lands well for depression diagnosis. For dementia, also the same thing. You can do a MOCA, Montreal Cognitive Assessment, or SLUMS, St. Louis University Mental Status Scale. And if you do it, you'll be amazed to see, because a lot of patients in hospital, they all are confused.
Sure.
Because they are demented. You have changed their place and there is an acute stress insult. If you understand that they have dementia, but they talk well, they reason well. I mean, so unless you do the test, you won't know. So depression is common, we need to treat it. And most patients get only pills, but counseling is equally important.
Okay.
And it causes approximately 8 to 10% of benefit with pills plus counseling.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
For many of us, eating too much salt plays a big part in causing hypertension, because salt, it bulks up the volume of blood flowing through your arteries. High blood pressure will increase your chance of stroke, heart attack, and kidney disease. So read those labels and watch your salt. Come on, guys. You can do it, because time waits for no one.
This New Orleans woman used to weigh 140 pounds. Now she's at 115. This Metairie man trimmed his 38-inch waist to 30 inches. They have something in common. They decided to start weightlifting more than 20 years ago. Today, they defy stereotypes of senior citizens.
I just made 70 January the 8th.
After a second divorce, Emelina Edwards became a single mother of 2 with no job and fell into a depression. That's when she decided getting healthy was a place to start.
When I turned to the side, my stomach came out further than my chest. And I thought, I have to do something. And
getting fit became her career. Today she's a personal trainer, working on a book. She writes fitness articles, speaks to conventions, and has created a video, cookbook, and motivational publication.
I have never felt better. I'm stronger, I'm happier. I am just passionate about what I do more than I was, even 10 years ago.
Bob Gale is 73 and says even though he coached high school athletics and did some exercise, his life changed when he started building muscle by weightlifting.
That was work. My weight dropped. I lost about 35 pounds. And my endurance. And I'm living now. I'm really living a good life because I feel healthy.
Studies show the commitment Bob and Emelina made to work out and eat a diet of fresh fruits, vegetables, whole grains, and fish will change their futures. Their lifestyle will boost brain, heart, lung, muscle, and even skin function. The immune system will be stronger, fighting off infections and even cancer cells. They will be less likely to fall, get osteoporosis, and even slow down arthritis and Alzheimer's. And they will be less likely to go into a nursing home.
Less infections, less risk of pneumonia, less risk of urinary tract infections, less risk of depression.
Dr. Cephalou says the more you exercise, the less you'll notice the aging process. Oh, and the name of Emelina's new book?
Well, it's titled 70, the New 40.
The other item which I always wanted to discuss in the elderly is the falls. I mean, they're always having an issue with that, fracturing their bones and their hip and going to surgeries, and the more complication they will develop in the future. What is your best recommendation for that population? I mean, is it to check them ahead of time and advise them what they can do from the physical standpoint? Because, some of them, they want to do everything.
Yep, thank you for asking. That's a very, very important question. Falls for me is like heart attack for you.
Yes.
So when you get a heart attack, cardiologists do everything in their, for me, falls, I give that kind of importance. Because falls is never because it's something simple. It's always multifactorial. There's several reasons. So you need to go from head to toe. The fall, if you're assessing, I would start with the patient. So there is what is called fear of falling syndrome. And in that, 60% have never fallen. But because their grandma or grandpa has fallen and broke a hip, oh, I don't want to do what my grandpa did. And then if you don't use it, you lose it.
Sure.
So it's like our pre-diabetes or pre-dementia falls. I mean, fear of falling is like that. So we need to catch them, educate them the right way of doing things, and make sure that they wear the right footwear. Make sure that they're able to see well. So one of the common things I see in older adults is bifocal lenses. With aging, bifocal lenses cause more falls. So simple things like that. And they don't have the ability to see colors properly.
Sure.
As you age, dark colors. So they may not be able to, and if they have macular degeneration, they can't see. So you have to adapt to all this, find out what the vision problem is. If they can't hear well, that can cause. If they have dementia, they cause falls. Depression causes falls. Medication causes falls.
So what your focus basically is to try to find the reason,
treat
the reason, and that will hopefully
that will
prevent
falls.
the falls.
And fear of falling, the best thing is to educate them and get them involved in activity. And if I have to do 2 things for falls or 3 things for falls, I would strengthen the quadriceps. One thing that happens with aging is when we are getting up as a young person, you recruit quadriceps first and then the lower extremity.
Sure.
Older adults recruit lower extremity, and that's why they have quadriceps. So when they're watching TV, I want them to buy some ankle weights and keep doing exercises, trying to strengthen their quadriceps. And the next thing I would do is calcium, vitamin D. Make sure and they take enough vitamin D to help them strengthen their bones and as well as reduce falls.
Before we end this discussion, which is really very informative, and I really appreciate it, I want to talk about the obesity, overweight. I mean, which is, you see 2 types of population in elderly people. The one which is really not eating very well, and those are the one losing weight, unfortunately, and the one who are not very active and eating unhealthy and junk food, and they end up extremely overweight. So how can you advise? I mean, the one which is losing weight, we already talked about the possible reason and how to treat them, but what about the one which is overeating and gaining that much of weight?
In older adults, as you rightly said, the BMI of less than 18 has increased risk of death. And BMI is body mass index, as you well know, height and weight. If it's more than 32, also has increased risk of death in older adults specifically. So again, it goes back to diet and exercise, smoke and alcohol. And I have learned that alcohol is quite prevalent in older adults, and it's a problem. I try to tell patients to go vegetarian, but a typical American diet has meat and potato in it. And what I would tell them is, can you cut down on the bread and sugar? Diet and exercise are one of the key things in order for obesity. And one of the commonly missed things is sleep apnea, which is not so well recognized. And so I like to ask them, how are you doing your sleep? And I get a good history of their diet habits and what's making them feel, and screen them for depression, screen them for dementia to see whether they're even able to process.
What about diabetes as a very common disease also in elderly?
It's very common, and again it goes back to trying to prevent diabetes by doing eating well and exercise and taking your medications on time.
And that brings me, you mentioned dementia really.
Dementia is a prevalent problem. It's rising into the most common cause of death in the United States. And one thing that I would strongly recommend older adults is to be actively engaged with their brain and not just playing bingo. There was a study done that showed that if you learn a new activity that you're not used to, so you being a cardiologist all your life, suddenly, and your hobby is to play piano, now I'll take you out of that and ask you to start singing and learn singing the classical way and learn all the notes, and so that will help. And or ask you to paint, something that you've never done in your life before. If you do that, your risk of progressing quickly to dementia is lower.
Do you think we are doing a good job in talking to our senior people and try to educate them about that stuff. I see most of the people really in the nursing home, the only activity they do is they wake up in the morning, they go to breakfast, they play the bingo, and then they go back for their nap, and then they go for the dinner, and the same cycle. And so in that case, we are not doing, the professional, we are not doing the right thing.
I completely agree with you. There is what is called the 3 Bs, birthday, bingo, and breakfast. And you're right, the activities needs to be person-centered, what you like, and then teach you things that are out of your comfort zone, and that will actually engage you and help you be more active. And also the social networks that need to be created has also helped.
And for these elderly people, I think the family support and the social environment which they are living in, it's also very important to prevent most of the stuff which we are talking about, from the falls to the depression to the some of the other elements of eating healthy or exercising and being active.
Absolutely. And there are a lot of community programs in Toledo, and we connect people to the programs. And one of my dream is to make my clinic a community center, wherein all these Zumba, Tai Chi, all the evidence-based stuff that I can do in that clinic, so that it will be a center not for just medical, it should be a center for wellness and aging well.
I think that's a good way to end our program, and we will support that, and we will be with you there, and maybe we will come and exercise with you in that case, and with the rest of the elderly people we have in that area. I really appreciate you being here. I enjoyed really your information, and I have no doubt that the audience and the viewer basically will enjoy that discussion. We thank you very much, and we wish you the best of luck.
Thank you very much, Dr. Kabour, for having me here. And my new location is at UTMC 333 Glendale Avenue, and I hope to look forward to doing some Zumba with you.
I have no doubt we will be there.
Thank you, sir.
Thank you.
Appreciate it.
Stay physically active with regular exercise. Stay socially active with friends and family and within your community. Eat a healthy, colorful, well-balanced diet. Don't neglect yourself. Regular checkups with your doctors, dentists, and optometrists are even more important now. Now is the time to savor good health and happiness. Remember, time waits for no one.